So, a very good evening and welcome everyone present here. My name is Dr. Urusa Hafiz. I am a dentist practicing in Mumbai. I have been working in COVID duty since the last 8 months, and I've been back to the clinic since 2 months now. I have had a very keen interest in child psychology, child behavior, and their behavior management. So, today I am going to speak on a topic that is very important and that I feel the parents, especially the young parents, they should be aware of. That is a child's first dental visit. So I'm going to cover a child's first dental visit. What should you expect during a child's first dental visit? And how do you prepare your child for the visit? And lastly, how do you take care of the child's teeth at home? So now a child's first dental visit is something that has a very lasting impact on the child throughout the lifetime. So, it has to be um it has to have a very positive impact on the child. That is why it is a very important and essential visit. It has to be well prepared, and the parents play a very important role in that. The American Academy of Pediatric Dentistry, AAPD, recommends that the child's first dental visit, it should be from 6 months of eruption of the first tooth, the first baby tooth, until 12 months of age. That is, जब तक का आपका child 1 year of age का नहीं होता है. That is 6 months of eruption of the first primary tooth to 12 months of age. That is when a child should visit a dentist, ideally for the first dental visit. Now, what happens when a child visits a dentist for the first time? The parents are very anxious that our child is very young. When should we take the child? And usually, what happens is, and especially in India, because there is not enough awareness, parents, they don't take their children to the dentist until there is an emergency or until they have some pain or until they find some decay. But ideally, that is something that shouldn't happen because preventive dentistry is very important. By preventive dentistry, I mean to say that a dentist can educate you, the parent, about the child's dental health and how can they prevent certain diseases, certain dental caries from happening. तो बेसिकली चाइल्ड का जो फर्स्ट डेंटल विजिट होता है वो यूजुअली 30 से 45 मिनट्स के अराउंड होता है. इट ऑल्सो डिपेंड्स कि चाइल्ड का अगर उसे कोई डीके है, कोई प्रॉब्लम है, अगर उसका स्केलिंग मतलब क्लीनिंग करना है अगर, तो बेसिकली इट डिपेंड्स ऑन ऑल दिस फैक्टर्स द टाइम टेकन फॉर द चाइल्ड्स फर्स्ट डेंटल विजिट. When a child comes to a dentist, what we do is, for the first visit, we will check all his teeth gently and thoroughly. We will check for his oral cavity, his oral hygiene, the oral tissues, जो gums होते हैं, जो oral cavity in general होता है, तो हम basically सब check करते हैं. One thing that we check for again is we check each tooth for white spots. White spot is something जो एक टूथ पे आपको दिखता है, it is a visible white spot. That is something that is an indication कि caries start हो रहा है. So this is again a very important reason why the parent should get the child for a dental visit. Because अगर हम उसे उसी वक्त catch करते हैं white spot को, so it is totally preventable and the caries can be prevented. So that is why it is very important to have the first dental visit as soon as the tooth has erupted in the dental cavity. During the first visit, हम ये भी बताते हैं कि what is the proper brushing technique and how do you take care of your mouth. And most importantly, the first dental visit होता है, it is nothing but an icebreaker introductory session because the child is very young. So we want the child to come to look at the surrounding, to get acquainted with the dentist and dental office में क्या instruments होते हैं, क्या procedures होते हैं, basic procedures and office setting कैसा होता है, and just to build a rapport with the child. That is something that is the aim of the first dental visit. Of course, apart from the treating the disease or the caries if there is any. तो basically हमारा वो हमें ये होता है कि the child has a positive impact. He is in a friendly way. He builds a connection with the dentist so that उसके जो subsequent dental visits होते हैं, those are good enough and he's ready to come back to the dentist and he does not have या एंग्जाइटी नहीं हो उसे कि वो वापस आए डेंटिस्ट के पास. तो फर्स्ट विजिट जो होता है वो हम शॉर्ट रखते हैं short and introductory icebreaker session होता है basically, जिसमें we want to create a rapport with the child and we want to uh, become friendly with the child. We want the child to become comfortable in the dental surrounding. So बहुत सारे जो first dental visits होते हैं, sometimes a child might cry, but that is totally okay. It also depends on the parent. Parents बहुत apprehensive होते हैं. Parents are also very anxious about what is going to happen. So it is recommended that the parents, they ask the dentist beforehand, before the child comes to the dental clinic. The parent, they know what are we going to do during the visit, if there is any procedure to be performed, so that the parents are comfortable getting the children, because the children look up to the parents eventually. And if the parents are apprehensive, अगर parents खुद डरे हुए हैं, तो फिर बच्चे खुद डर जाते हैं. So it is very important for the parent to be well informed कि बच्चे के साथ क्या होने वाला है डेंटल ऑफिस में, उसका ट्रीटमेंट कैसे होने वाला है, क्या करने वाले हैं, ताकि वो खुद जो अपना बच्चा है उसे संभाल सके. So that is basically a very important point. If in case a child is uncooperative, or if he's crying a lot, and if in case he's just not ready to listen during the first visit, it might happen that we might have to reschedule the visit, and that is totally possible. Even if a child cries during the first visit, that is okay. No one needs to panic. We can call for another visit and the child can be handled at that time. The child might become less apprehensive. Now, for this, it is important for the child to have the first dental visit usually in the morning time, because morning time is something that is the child is well rested and he's active, he's alert. So at that time, it is preferred to have the first dental visit. Now, during the first visit, a dentist can also go for some slight scaling, that is cleaning, polishing, removal of stains and tartar and plaque. That is also something that can be done. Now, I want to speak about how would you prepare your child for getting into the dentist. Now, this is something very important. Before the child comes to the dentist, parents play a very important role in that, in preparing the child for to get into the dentist. Now, before you get the child to the dentist, आप उन्हें shows बता सकते हो, movie बता सकते हो, या कोई story book you can read out to them, जिसमें ये रहे, जिसमें आप ये बताओ कि a child is going to a dentist, or in which you can show a movie in which you can show that a child is going to a dentist. It's a pleasant visit. So ये देखिए, the child has a positive impact on them, or a positive impact about getting a dental treatment done. So that is something that you can do, that a parent can do before getting the child to a dental office. Secondly, you can play, you can become a dentist, and your child can become the patient, and then at home you can try to show them that okay, this is a dental office, and or you can let the child become the dentist and you can become the patient, and you can help him develop that understanding that okay, teeth check करना होता है, दांत चेक करने होते हैं, एक डेंटिस्ट होता है जो ये सब करता है, एक ऑफिस होती है उनकी, क्लिनिक होता है. So this is something that can be done to prepare the child mentally for the dental visit. Then you can let the dentist know beforehand if the child has any apprehensions, any fears, any disabilities, either mental, physical, psychological disabilities. So आप dentist को पहले से बता सकते हो, so that we are prepared that okay, this child is coming for his first visit and this is how we are to handle him. Then you have to be very careful, like I've already mentioned, कि आप आपके child को क्या बोल रहे हो. Before getting into the dentist, you should be very careful of what you tell your child, okay? Because that is also again very important. It plays a very important part in the psychological aspect of your child, how he's reacting, how he's understanding about going to a dental office. So parents over here, I'm trying to tell you that it's very important that you give a positive impact on your child's mind, so that the child is happy to come to the dentist again, okay? Then uh, again, you have to be very confident when you bring the child. You have to be aware of the dental treatment that is going to be happening, if in case there is any. So you need to be aware of what is going to happen, and accordingly, you have to plan the treatment and plan the day. Okay. Now I'm going to share some tips on how can you take care of the child's teeth at home. Now, before the teeth come in, when the children don't have teeth, at that time, what you can do is when the children's gums are very hard, like comparatively to the adults, their gums are hard enough because they can chew things when they don't have teeth also. So, that time, you can use a clean and damp cloth and you can wipe their gums. This is important. This is something that you can do before the teeth erupts. You can start brushing. Now, this is a very common question that many parents have. That when do we start brushing the teeth? Which toothpaste do we use? Which toothbrush do we use? How many times do we brush the teeth? So I'm going to tell you one by one. You can start brushing the teeth as soon as the tooth erupts in the oral cavity. Now you don't have to brush vigorously. आपको बहुत जोर जोर से भी नहीं करना है. You have to use a soft bristle toothbrush. ठीक है? जिसके bristles soft होते हैं. You have to use that toothbrush for a child, for a toddler, and you have to use a non-fluoridated toothpaste जिसमें fluoride नहीं होता है for children less than 2 years of age. क्योंकि less than 2 years of age, they tend to swallow the toothpaste. That is why we don't want them to swallow. इसीलिए हम non-fluoridated toothpaste use करते हैं for less than 2 years of age. More than 2 years of age, हम fluoride वाले toothpaste use करते हैं. What does fluoride do now? Fluoride is a mineral that forms a layer around the tooth and it protects the tooth from caries. That is why fluoride is important. So now this is also something that is told during the first dental visit, that how many times can you come for a fluoride treatment. Fluoride treatment is nothing but there is a tray जिसमें हम fluoride gel डालते हैं and it is kept inside the child's mouth for a few seconds, and that actually prevents a lot of caries. So that is something that can be advised during the first dental visit. Okay. Now, what else can you do is you have to limit the child's uh, habit of the thumb sucking. If you notice that the child is sucking his thumb, so these are some of the habits like lip biting, thumb sucking, tongue thrusting. These are some of the habits that children develop, among others, that a dentist can recognize at a very young age. So this is something that the dentist can advise that this is a habit. This can cause these effects. Like for example, thumb sucking can cause proclination of the anterior teeth, which will cause malalignment of the teeth. So this is something that the dentist can tell you during the first visit, that the child is potentially developing this habit. So you can avoid this habit by doing these steps. One more thing that I would like to tell you is a very common thing, that a mistake that parents do is the giving milk bottles while the child is napping, or before the child goes to a nap, goes to sleep. Now that is something that again, the child keeps on sucking over the bottle, over the nipple. So because of this, again, there is proclination, malalignment. So there are a lot of dental tips and oral hygiene tips that the dentist will give you when you visit the dentist for the first time. So these are some of the things that I wanted to explain, and I will now go with the questions if you guys have any. I'm ready for questions if there are any questions from your side that you all want me to clear. So where do I find the questions? I'm reading it wrong. Okay, so I've got my questions here. The first question is from Dr. Romera Zaki Ahmed. So she's asking, how many chocolates should be given in a week? My baby is a chocolate lover. Please help. So, hi, Dr. Mera. First of all, there is no like there's no number that your baby should have these many chocolates and these many they shouldn't. But what I can suggest is that limit the intake of chocolates to one or two in a day. And this is one thing that is very important: is after your baby has the chocolate, see to it that she is drinking water, and when she has the water, she gargles it and then she takes it inside. Okay. Now, because of this, what will happen is if there is any chocolate particles that are stuck on the tooth, so at least she'll gargle it and take it inside. So the remnants are not there on the tooth surface. So this is something that we can practice. But then, of course, there's no number that children should have these many chocolates. You have to limit it. If she's having too many, then of course it's not done. You have to break that habit of having too many chocolates because it will really cause problems later on. The next question I have is from Lakshmi Mishra, and she is asking that how to maintain dental hygiene of my baby. Now, like I've already elaborated, but I'll just mention it again. It depends on the age of the child. Now, if your child is less than 2 years of age, you have to use a non-fluoridated toothpaste. There are many available in the market. They come with variety of flavors, and you can use a soft bristle toothbrush. You have to use a very small quantity of toothpaste when the child is less than 2 years of age. It has to be pea size, that is like really small. Okay. uh, Quantity of toothpaste and a soft bristle toothbrush. And when you are brushing your teeth, just see to it that you are brushing for the child. Let him play around with the toothbrush, let him get the idea of how and what is to be done with the brush. Make him stand in front of the mirror, show him how you're brushing. And initially when you start, so move in circular motions, see that all the tooth surfaces are covered. Let your child gain interest in the concept of brushing teeth. That is important. If your child is more than 2 years of age, then you have to use a fluoridated toothpaste. And like I've already told you, the advantage of using fluoridated is that उसमें fluoride होता है. Fluoride जो है, it is a mineral जो एक layer form करता है tooth के around, and it prevents dental caries. So you have to brush 2 times every day. You have to inculcate that habit in your child of brushing twice a day. क्योंकि prevention is better than cure. अगर आप अभी से prevent कर रहे हो, उससे बाद में बहुत सारे caries and बहुत सारे dental problems prevent हो सकते हैं. So that is one thing that is very important. Mm, Okay, the next question I have is my son is 3.5 years old. He's got white spots on his teeth after brushing his teeth as well. What should I do presently using my toothpaste? Should I need to change it? So, first of all, which toothpaste are you using? Does it have fluoride or not? And secondly, his sugar intake. Is he having a lot of chocolates, sugars, sweets, juices? And thirdly, if in case it doesn't go away, you need to visit a dentist. He might require an X-ray. It should go away on its own. It is reversible. But if in case it doesn't, you need to visit a dentist. An X-ray might be done. We might have to see if there is actually caries formation inside, and if it has reached the nerve, and then the further treatment plan can be decided. But what is very important is maintaining a very good oral hygiene. which I have explained in my previous question, that how would you do that? So that is something that you need to maintain. It should be reversible. It should go away, but you need to be aware of which toothpaste are you using, if it does contain fluoride or not, and also if his oral hygiene, like if there is any calculus or plaque or any dirt in his teeth. If in case there is, then a scaling and polishing might also be required. Um, Okay, now Varsha is asking me, how can I strengthen my child's teeth? Like I've told you, brush his teeth regularly. Use fluoride toothpaste, like I've stressed upon enough. Use a fluoride toothpaste and watch his diet. Also, calcium supplements. Milk once a day, 16 to 24 ounces is a recommended amount. So milk is also important because calcium is very important for the developing teeth. And apart from that, the general development of the child. Okay. Okay, I have a question here from Khushbu. She's asking me, my son is 2.5 years old, but not allowing me to brush his teeth, and he also does not want to do it. What should I do? I have varieties of toothbrush for him. His father brushes his teeth along with him, but still my son does not want to do it. Please help. Now, Khushbu, this is something, child psychology and child behavior management is an altogether a very vast topic. But at the end, he's your child. Uh, they will not agree, they will really not want to do it. Just let him play with the toothbrush is what I would tell you. Let him play with the toothbrush, let him see what it is, let him show him what you can do with it. What you can do is, there are finger toothbrushes also that you can use, so show him that. And if he's more than 3 years of age, so you can use an electronic toothbrush. So show him these different varieties of toothbrush, so that he can see that, okay, there are these different types. Then make him choose which one do you want to choose. Make him stand in front of a mirror and make him show that, see, this is how you brush your teeth. Let him do it. You do it, and then you show him that, just follow me and brush your teeth, and tell him to do it. And basically, these are some things that you can do. But children, they are at the end, they are children. He's your child. You need to manage him. Just be calm with him. Just don't get angry. Let him play with the toothbrush. Let him understand the idea of using a toothbrush, and understanding that, okay, his teeth are important. Try to make him explain that, show him images that if the teeth are bad, so there will be germs on the teeth and they'll eat the teeth. So try making him understand all of it. But then it will not happen like, very fast. It's a gradual process, so you just have to be calm during all of this. Okay. Next question I have is, can you explain a little bit about cavities? How can I take care of that? How often should you brush a 2-year-old's teeth? So first of all, Padma is asking me, can you explain a little bit about cavities and how can I take care of that? Now, dental cavities is something, it's basically a dental disease, okay, in which the tooth surface is decayed. Now, this decay, it depends. Now, the tooth has 3 layers: the enamel, that is the outer layer, the bite layer that we see. Then is the dentine, that is the inner layer, and then innermost is the pulp, that is a nerve, right? So basically, cavity is something that affects the enamel, and it can go inside the dentine, and then it can reach the pulp. Now, this happens when the oral hygiene is not well maintained, when you're not taking care of the hygiene, when you're not brushing the teeth, when you are eating a lot of sweets and you're drinking a lot of juices. So basically, you have to be very careful. And the earlier the caries or the cavities that is diagnosed, the better, because if we catch it earlier, the treatment is much easier. If it goes inside, if it goes in the dentine, or if it reaches the pulp, so the treatment also, the time also increases, the procedure increases, and it becomes more uncomfortable. So it's better if it is arrested and if it is caught at an early stage. Next question that she's asking me is, Padma is asking me, is how often should we brush a 2-year-old's teeth? 2 times you have to brush their teeth, morning and night. In the morning, you can brush for like 2 to 3 minutes. At night, you can brush for 5 minutes. And use a soft bristle toothbrush. That is important. Do not use an electronic toothbrush for children less than 3 years of age. Okay. Next question is it okay for toddlers to swallow toothpaste? Now, like I have already mentioned that, if the child is less than 2 years of age, the toothpaste is non-fluoridated, and that is the reason why it's non-fluoridated, because they might swallow it. That is the harm. We know that they might swallow it, so it does not contain fluoride. So less than 2 years of age, if you're using a non-fluoridated toothpaste, it is completely all right. More than 2 years of age, it does contain fluoride, and the child should be, he should be told that how, and they develop an understanding that you how you have to brush, and you don't have to swallow, you have to spit it out. So more than 3 years of 3 years of age, children tend to spit it out. That is why they have to write. Less than 2 years of age, and if he's a toddler, then yeah, there's no problem if he does swallow. But see to it that you use a very small size of toothpaste, a small amount of toothpaste. So I think these are all the questions that I have. So I will just summarize the whole session. So I have covered on child's first dental visit. It has to be from 6 months of eruption of the first tooth until 12 months of age. That is, उसका जो first birthday होता है, तब तक का at least he has to visit a dentist. This is an ideal situation that the child should visit. Now, why should he visit? Because prevention होता है, बहुत सारे चीजें जो हम prevent कर सकते हैं, a lot of habits that potentially be caused, वो हम prevent कर सकते हैं. And the dentist can advise on oral hygiene and how to maintain the oral hygiene of the child, how to brush the teeth, techniques, everything can be covered. So that is why it's very important. But mostly the first dental visit is an icebreaker so that the child comes, he sees the environment, he sees the dentist, he sees the instruments. He knows कि यहाँ पे जाना है, he's setting it, and he's aware and he's happy. He has a positive impact. So that next time when he has to come, he's not scared of it. Because this is something very important, that one bad dental experience and the patient, no matter a child or an adult, will always be scared to go back to the dentist. And dental phobia is a real thing. Many people are scared to go to the dentist. The major reason is because they have had a bad dental experience. तो ये हमें नहीं चाहिए कि हमारे बच्चे के साथ जो फर्स्ट डेंटल विजिट हो उसमें हो. We want him to have a very positive effect. इसीलिए pediatric dental clinics जो होते हैं, they are colorful, and the chairs are different and there are toys, and it is designed in a way that the child would like to come back again over there. So that is something very important. Then I've also told you how to brush the child's teeth if he's less than 2 years of age, more than 2 years of age, and also how to take care of the child's teeth when he's at home. So that will be all for today. It was really amazing talking to you guys. This was my first session, and I was really excited for this. And I hope I was able to resolve your queries. In case if you have any more, you can DM me on Instagram. My username is Urusa Hafiz. So you can just message me if in case you have any other queries. And it was really a pleasure talking here and having so many people listen to me. I hope I was of help. And with this, I will conclude today's session. Thank you so much for giving me this time. It was really an honor. Thank you, everyone. Thanks and bye.